It means a lot to have you here, even virtually. We know that we will be together again in person very soon, and it's just great to have you here on screen tonight. You know, our President's Council reception last June was Dimmick's first virtual event. Since then, we've had a full year of virtual events, including Steppin' Out last fall, a welcome reception for Dr. Anderson in January, our annual meeting in March, and I think some of you were at all three of those. And I know you've gone to many other virtual meetings and events. Since its launch 5 years ago, the Dimmick Center President's Council has brought together a strong group of leaders whose commitment to Dimmick patients and families runs deep. Your philanthropic support, time, energy, and leadership help us reach close to 19,000 people each year through our health center, behavioral health services, and early education programs. I want to express my tremendous gratitude to the members of the President's Council, our board members, and all of you here with us today for your generous personal gifts and the support of your companies for Dimmick, especially during this past very challenging year. We look to you all year long to be Dimmick ambassadors, provide wise counsel, help us expand our life-saving work, and create new programs. So much has happened this past year. It has been sobering to see the continued impact of a global pandemic right here in our Roxbury neighborhood. In partnership with you and other generous friends, we've worked hard to continue our core services while responding to the urgent new needs of our vulnerable patients and families. We still have a lot of work to do, and we will do it in partnership with you. I want to take this opportunity to highlight a major focus of this past year, the COVID vaccine rollout and ongoing vaccine outreach and education for our community, many of whom have been disproportionately impacted by COVID-19. It's now my pleasure to premiere a brand new video about Dimmick's role in helping to build confidence in the vaccine and distribute it to people who need it the most. We'll see this on our screen now. Let's take a look.
I'm Melissa McDonnell, president of the Liberty Mutual Foundation, and Liberty Mutual has partnered with Dimmick for over 3 decades. We know Dimmick staff and patients and families. We understand the vital role that they play in Boston in the lives of generations of families. And we have made a deep commitment to Dimmick over the past year of the pandemic to help Dimmick provide all the services that they consistently do and also respond to the new and growing needs spawned by COVID-19.
One of the main reasons why I decided to take the vaccine is to be a representation for my community. I know there's apprehension and I know there's fear, but right now is the time to do the most brilliant, most brave thing.
It's a saving grace. It's come at a time when I really, really needed to be able to connect back with my family.
We can't defeat this pandemic if we don't all lessen our ability to transmit it. We understand the hesitancy, but let's not allow our hesitancy or our fears to cost us or others their health or their life.
And this is an act of love for a community that I love. This is a bad disease, and I don't want to get it, and I don't want anybody else to get it either.
I realized that taking this vaccine was going to help save my life and my family life, my immediate family's life, and others around me, and that really made me decide to take the vaccine.
Here at the Dimmick Center, we've got such a trusted relationship with this community, and it's something that has been earned over a century. People are coming in every day to receive a vaccine, and they've gone through all the calculus in their mind to determine whether or not this is going to be something that's going to be important to them, their families, and their community. As an African-American male, I'm 4 times more likely to be hospitalized if I'm infected, and I'm 3 times more likely to die. It's part of that calculus that brought me to that point to know that this vaccine was going to be incredibly important.
Reach out to your doctors, to your nurses, to our advocates in the Latino community so that you can understand how the vaccine works and know that it's safe.
I try to make people of color understand that we're not the only one getting the vaccine. That's the most important thing. The whole world, no matter what color you are getting that vaccine. So we need to live in the right now and not look back at history on what things have been done to us as people of color.
This is a way to empower us to take back the control, to be able to get back to that place where we can enjoy those things that we realize after this long period are even more important to us than we had thought. To get back to a place where people are back to work, to get back to a place where we can comfortably go out and shop, to travel, all those things that make us who we are and allow us to just enjoy this thing, this precious thing that we call life.
I haven't seen my mom in over a year, and last week I was finally able to visit her in person and give her my first hug. Just the ability to give hugs and kisses to those we love is going to be something that I'm going to do a lot of.
We often ask ourselves, why did this have to happen? Is there something we could have done? Well, the reality now is we have the opportunity to be on the right side of history. There's things such as wearing a mask. There's things such as practicing social distancing. And there's things such as making sure that we listen, that we learn, we open our minds to explore what is in it for us in this vaccine. Just like when we vote, every vote counts. In this case, every arm that's vaccinated counts as we work together to defeat this virus and to get back to our normal lives.
Well, thank you so much for sharing that wonderful experience of watching that brand new video. That really is a snapshot of an incredibly important time in our history, Dimmick's history, our neighborhood's history, our world history. And we are so grateful and proud that we can do this work in partnership with you. You saw a number of our vaccine street team members on that video. We're so grateful to them for their consistent support and advocacy. We're grateful to Liberty Mutual Foundation for helping us to create that video and to do lots of other outreach work. And I'm also grateful to Blue Cross Blue Shield of Massachusetts for helping us conceptualize all of our outreach efforts starting back last winter through a video and written story project that they did with Dimmick. We have a terrific program for you tonight on a timely subject. And to get us started, I'd like to introduce to you to two very special members of the Dimmick family. The two co-chairs of our President's Council have made supporting our community and the Dimmick Center a priority. They have given countless hours of their time to help shape and lead Dimmick. Moreover, they are role models and mentors to many of us. And they helped to create the Vaccine Street Team this year. Please join me now in watching a beautiful video greeting from Flash and Benny Wiley, President's Council co-chairs.
Of the center, we'd like to welcome you to this special event for our members. And most importantly, we'd like to thank you for the many ways that you support Dimmick throughout the year. The President's Council is an essential part of the success of the Dimmick Center. I'd like to introduce you to my husband, Flash Wiley, who, as many of you know, was the former chair of the board of the Dimmick Center for a number of years, and just how we both became involved. So I'll let him share his welcoming remarks as well.
Well, as Benny said, it's so very important to our community for you all to be actively involved in the President's Council to help sustain the important work that Dimmick does for our community. And we're so very proud that so many of you have stepped forward to assist in this important effort. And thank you so very much.
Thank you and enjoy the evening. Bye.
Thank you so much, Flash and Benny, for all you do. And it was wonderful to see you, even just virtually on screen. And we can't wait for us to all be together again. It's now my pleasure to introduce another amazing leader, role model, and mentor. Bob Rivers, Chair and CEO of Eastern Bank, has been the chair of the Dimmick Community Foundation Board for the past 3 years. Bob's leadership and guidance have been transformative, especially this past year. Before I turn things over to Bob for his remarks, and before he introduces our special keynote speakers, I'd like to just ask all our guests tonight, as you're coming up with any questions for the keynote speakers, please put them in the Q&A box on the bottom of your screen instead of the chat. And we'll be sure to get to as many questions as possible after the discussion. Bob, thank you again for all you do, and please share some wonderful words of wisdom with us, as you always do.
Well, thanks, Raquel. Appreciate the kind introduction, and good evening, everyone, and welcome to our 5th annual celebration of the Dimmick Center's President's Council. It is great to have you all here. The days when we'll be back together for special events like this are just around the corner, but for tonight, we're glad to have your company virtually. I'd like to first share a heartfelt thank you to our President's Council co-chairs, Flash and Benny Wiley, for your beautiful welcome video. As many of you know, Flash is Chairman Emeritus of the Dimmick Center's Community Foundation Board, and he continues to be a strong voice of wisdom and leadership for Dimmick and for so many of us throughout Greater Boston. It means a great deal that Flash and Benny chair our President's Council. It really has been a remarkable year since our last council reception. First and foremost, I hope that you, your families, and colleagues are doing well and feeling optimistic about the future. In the midst of tremendous challenges in our community, the Dimmick Center has remained steadfast in providing quality healthcare, mental health support, and education to children and adults. Dimmick has always provided this care for all people, in particular those from often less served Black and Brown communities. Dimmick has served generations of families from Roxbury and other neighborhoods. We are committed to breaking down barriers to care and addressing longstanding racial inequities by providing everyone who lives in Roxbury and other surrounding communities with access to comprehensive, high-quality healthcare, mental health support, and early childhood education. This commitment to anti-racism work could not be clearer than it is today. Our work over the past year directly addressed the health inequities faced by our community as a result of COVID-19, along with the devastating economic impact on low-income people and ongoing racism. Since our President's Council last June, Dimmick has not slowed down. We are thrilled that our programs and services are open in person again and reaching all who need care. We're also continuing some new efforts that we launched during the pandemic, including distributions of healthy food to patients and community members, supported by Fidelity Investments, Stop and Shop, and Teddy's team. And thanks to the leadership of our new President and CEO, Dr. Charles Anderson, Dimmick has been a leader in the vaccine education and vaccine equity conversations and has remained dedicated to increasing the vaccination rate in communities of color. More than 90% of Dimmick's team of over 500 professionals are vaccinated, and Dimmick has provided 10,000 vaccinations to patients and community members. We also recently opened a pop-up vaccine clinic hosted by Bethel AME Church in Jamaica Plain in an effort to expand our reach in the community, and more pop-ups are being planned. Yet we know that, as Dr. Anderson has often said, the vaccination needs in our community during the pandemic are really just the tip of the iceberg. The trauma and loss that people experienced in the past year require a greater focus on mental health support and addiction treatment. The loss of learning and socialization for very young children created educational and developmental gaps that must be overcome. And people's deferred health care for routine screenings, chronic conditions, and dental care has led to more acute and serious conditions. Simply put, Dimmick's work is more critical than ever before. So tonight, as we celebrate the milestones of the past year and welcome a return to a version of normal life, we must recognize that the toll of the pandemic is still being felt in our community. Your support over the past year has been critical to our success in meeting the needs of our vulnerable community, and I ask you to continue your generous support as we face the new crisis of deferred and delayed care. Tonight, we're excited and honored that Dr. Eddie Glaude is joined us for an important discussion on the ethics of anti-racism and health equity. Dr. Glaude is the James S. McDonnell Distinguished University Professor and Chair of the Department of African American Studies at Princeton University. He is an author, political commentator, and passionate educator. Dr. Glaude's most recent book, the New York Times bestseller, Begin Again, James Baldwin's America and its Urgent Lessons for Our Own, takes a wide look at Black communities, the difficulties of race in the United States, and the challenges we face as a democracy. He will have a conversation with Dr. Anderson, who many of you have gotten to know well over the past 6 months. Dr. Anderson came to Dimmick at a time of tremendous change and challenge in our community, joining us at the beginning of this year. Over the past 6 months, he has jumped in and embraced the Dimmick Center, taking the time to get to know supporters, staff, and patients. We are so grateful for his compassion, his vision, and his leadership, and look forward to much more in the months and years to come. We're in for a terrific conversation, and we'll have time for questions afterwards. Thank you all for joining us tonight, and welcome Dr. Anderson and Dr. Glaude.
Thank you.
Thank you. Thank you for the kind introduction. It's
Indeed.
always, look, we're going to just jump right into it. What I have to say, it is good to see you, and thank you for your contributions to really just helping us understand the work that is required to get to the other side of these hurdles. And I think, with that said, I'd like to just sort of set the context about the hurdles, because as you and I discussed, we said, okay, I'm the expert on health equity. You got the expert on anti-racism, and we got to put it all together when we have this discussion. But when we talk about health equity, the thing that jumps out at me, quite frankly, is that what is the outcome, right, of healthcare? At the end of the day, healthcare should lead to a life expectancy. And what's interesting when you talk about equity there, if you have one group of people who happen to live in a neighborhood where the life expectancy is 58, and then you go less than 2 miles away to another neighborhood where people look different and the life expectancy is 91, that's not equity. Right? I think we can all agree about that. When you look at Black women dying during childbirth or after at a rate that's 2 times that of white women, that's not equity, right? From a healthcare perspective, in terms of what healthcare is supposed to deliver, we're not seeing equity. And this movement of community health centers came out of this intersection between civil rights in 1965 and healthcare. And I'd be very curious as we talk about this, and what I'm really hoping to get into with you, Professor, here is, what have we learned and what have you learned from the writings of James Baldwin and all of your work that you do that should help us think about how we should be addressing this health equity conundrum?
Well, first of all, it's such a delight to be in conversation with you, Dr. Anderson. And I want to thank Brother Bob Rivers for that wonderful introduction, Flash and Benny Wiley for the generous video and their leadership. It's a wonderful time. It's wonderful to be in conversation with you. Look, it seems to me that what I've learned over my years of writing and researching and living in the United States is that, and Baldwin understood this intimately, is that we have to tell the truth. There is a reason why one community has a life expectancy of 58 and another community just 2 miles down the road has a life expectancy of 91. We have to understand that ours is the country we have made. It is not happenstance. Policies, social arrangements, political and economic arrangements have been deliberately put in place. I mean, when I think about the New Deal policies that gave birth to the vaunted American middle class, and how the agricultural sector and domestic workers were carved out, and who had access to the benefits of governmental policy that drove massive expansion in the post-World War II era, and how Black people were systematically locked out. When I think about all of those Black folks who served in World War II to defend freedom, and how they were systematically locked out of the GI Bill. When I think about banking policy, I think about residential segregation, I think about school segregation, you think about dual housing market, dual labor market, healthcare. None of this is just the random effect of people living together. No, it's rooted in a society, and this is what we have to confront. It is rooted in the society that has, for much of its existence, believed that because one was white, one ought to be valued more than others. That valuation then led to a set of arrangements that produced a kind of generalized sense of disregard for other people, for other populations. And we built it. Our built environment reflects it. So my answer to the question, it's not a conundrum. You just tell the truth and have a conception of justice without exception. If you have an idea of justice that is consistent across the board, not just a just set of arrangements for one group and another set of arrangements for another. No. If we tell ourselves the truth, that we have built the society true, then we have to be just as deliberate in getting rid of it. If racial inequality is a result of deliberate public policy, then we have to be just as deliberate in getting rid of it. It can't just simply be, lifting all boats. That's not how it was created. So I think at the end of the day, what I've learned from Baldwin, and it's a tough lesson, Doc. It requires Americans to grow up, to leave behind the so-called innocence of our adolescence, because the innocence is the crime. We don't want to take responsibility for what we've done. The fact that within a 2-mile radius, the life expectancy is 58 and one is 91 in the richest country in the history of the modern world.
Yeah, that's important, right? There's no doubt about it. And, especially some of the later writings of James Baldwin really captured that in a very interesting way. And let me ask you this. Let me share another data point here, is that the Institute of Medicine back, I believe it was 2001, did an interesting report looking at unequal treatment, and really outlined the fact that if you were Black and presented to an emergency room in pain, you're going to be treated differently, right? One of the other data points that I'd add is, here in Massachusetts, what we found is that from during this pandemic, the death rate due to opioid overdoses for Black men increased by 69% during this pandemic. And I could go on and on with some of those things, but let me ask you this. So if we are in agreement, as I know that many of us are here, if we're in agreement that these things are wrong, and we're all trying to figure out how to tackle these inequities, if we're in agreement that a lot of the source of this is this value equation that you talk about, if we're in agreement about that, what do we do? And now we talk about examining and accepting and understanding that part about where we are. And I don't want to just gloss over that. But if we can get to that agreement, what comes next? What does it look like?
Right. I mean, it seems to me that if there's genuine agreement, then the moral response is to remedy, is to move towards remedy. Right? I mean, Brian Stevenson would put it this way. He says, truth and reconciliation is sequential. First, you have to tell the truth, then you reconcile. And then I would add, reconciliation becomes the ground for repair. So if you're right, that there is kind of consensus around the description of the inequity, Then there is a kind of general consensus as to why it is the case. Then we have to marshal the wherewithal to respond to it in a very direct way. But we have to do so, Doc, in a way that's not charitable, that's not driven by philanthropy. Let me just try to give you a sense of what I mean here. Oftentimes, we think of racial inequality as the result of loud racists, people donning hoods or screaming racial epithets, when in fact, the oil of white supremacy in America is often a view that racial equality is a philanthropic enterprise. It is something that white people possess to give to others. And oftentimes when we have some kind of consensus around the description of how we've arrived here, we know that this is wrong. What gums up the work is that some people think they're doing some other folks a favor, that they're not working on behalf of a more just America. They're engaged in a charitable gesture. And that orientation means it's short-lived, because once the attention span shifts, they turn their attention elsewhere. So the remedy has to be rooted, I think, in a much more just conception of healthcare delivery, right? I think we have not yet as a society committed ourselves to the notion that every American not only should have access to quality healthcare, but should be able to afford it, to be able to sustain themselves, right? They should not go broke because they're sick, right? So I think there are a set of background commitments that we haven't agreed upon that kind of complicate the way in which we think about remedy with regards to healthcare disparity. Because what COVID-19 revealed, it was like a blue dye into the social body. It revealed where all of America's illnesses, right, are located. And the question is, you now see it, what are you gonna do? And what we see right now, there are those who are doubling down on the status quo, wanting to go back to what was in the face of what we know.
Interesting. It's interesting to talk about the access and affordability. There's often this other A that I talk about, which is approachability, right? So I think part of what we learned through this COVID-19 experience is it's not as simple as saying, let me put the vaccine site in the community.
Right.
It's not as simple as saying it's free, but there's this element of, is it approachable, right? Do I trust it? Do I not only trust the vaccine, do I trust those who are giving me the vaccine? And speak a little bit on that in terms of that approachability and how we should think about that.
Well, I think there's a kind of earned skepticism in our community. And I want to really emphasize the phrase, an earned skepticism. I mean, one can see it as, just read W.E.B. Du Bois's Souls of Black Folk, and you can read the chapter of the passing of the firstborn when his son dies of scarlet fever, in effect, because no hospital would treat him. Think of people in your family who were sick, who suffered from hypertension, diabetes, and experienced horrible treatment by doctors, or had an emergency and were treated rudely. Or think of all the videos circulating, right, on social media, showing example upon example of doctors treating Black folk with a generalized sense of disregard. I can't remember that, even in the 1960s and 70s, the Black Panther Party, when they opened up their clinics, a kind of preface to what the Dimmick Center is within a certain political framework. They wanted to treat specific ailments within the Black community. I'm actually repressing, Doc, this one disease that is often associated with Black folk. You know what I'm talking? I can't remember.
About sickle cell
anemia.
Absolutely.
People in pain, they don't want to treat them with pain. We already know the studies about Black folk and our ability to withstand pain. So we're not treated, our pain isn't treated in the same way. These are experiences that aren't abstraction. They're a part of family history, and they're part of individual encounters. So the idea of handing over trust to healthcare delivery when you've lost a loved one because they did not, pay attention to it. Think about Serena Williams after she had her baby and what she had to do in order to get attention paid to what was happening to her. And those are that's a very kind of famous story, but those sorts of stories happen every day. So there's a kind of earned skepticism. So if there's earned skepticism, then there must be earned trust. So how are healthcare centers present in our communities? How are they present before the illness? What are they doing to help promote well-being in our communities that are often healthcare deserts? What are they doing in those spaces to earn trust such that when these moments of crises hit, hesitancy isn't the first thing folk are talking about? Rather, people like me, let me try to get my mom and dad vaccinated because they had preconditions and I want to go home and hug them, right? As opposed to having to make my way through the sludge and the mess of the experience with healthcare in the United States.
Now, one of the things we talked about very often was not calling it as much vaccine hesitancy, but really more about building vaccine confidence. I think that lines up just with what you're saying, and that was our approach and the way we thought about it. But let me ask you another thing with regards to that. Sure. I think it's fascinating. There was a study released by the School of Public Health about the time here at Harvard School of Public Health. It's funny how, Boston, we say the School of Public Health and just assume it's but there was a study looking at this vaccine hesitancy. And what they found was fascinating. They did this elaborate analysis, almost 3,000 people, interviewed them, asked them questions about, do you think you're likely to get the disease? Do you think you're likely to die? And you think your family members are at risk, and all of that. And they put it all into this big analysis. And the only variable that was statistically significant was an experience of racial discrimination, right? Not a history of, an experience of. And when they went deeper, they found that the experiences were things like experiences on the job, experience, in the mall, experiences that were not necessarily healthcare related. Right. So I think it's interesting as we talk about this interconnection between things that are healthcare, non-healthcare, and talk to us a little bit about that, especially in the context of how we should be thinking about partnerships and what our role can be, even though we sit mostly in healthcare.
I think it's really important for us to understand the consequence of this valuation. If I'm right, that what white supremacy is at its core is this belief that certain people, because of the color of their skin, ought to be valued more. And that valuation evidences itself in our social and political and economic arrangements, and has done so for generations. Its consequence is a generalized sense of disregard. And that generalized sense of disregard cuts across a wide range of sectors, spheres, and domains. So one experiences a generalized sense of disregard within the context of public education. One experiences a generalized sense of disregard in terms of banking and loans. One experiences a generalized sense of disregard with regards to policing. One experiences a generalized sense of disregard with regards to healthcare, right? So it cuts across a variety of domains within the public and private sector of American life. And it becomes part of the common sense of not only the society at large, but the common sense of those who have to bear the brunt of that disregard. Now, what Aristotle, oh Lord, I'm quoting Aristotle, or invoking Aristotle. What Aristotle says is that explosions of anger are often not rooted in the moment of disregard, but the experience of accumulated disregard. So that moment when the police officer asks the question or disrespects you or grabs you or murders someone in broad daylight and suddenly everything explodes, it's not just that moment. It is this generalized experience, this accumulated experience that cuts across various sectors. And it's not as if human beings can segment it. Oh, I'm in the healthcare sector now. Oh, everything that just happened to me in the banking sector remains over there. No, you carry it all with you, right? Every place you go. So American society, if we're to be honest, if we are to be mature, right, is deeply and profoundly saturated by the value gap. And our task is to understand that and to finally try to figure out how to uproot it so that we can imagine ourselves otherwise. And the Dimmick Center has to imagine healthcare in a way that doesn't have that valuation at its center, right? And it has to be very deliberate in how it imagines remedying a healthcare system that has had the value gap at its center for generations.
Now that's important, right? And the piece of that really jumps out is this idea of value gap. It can very often be unconscious, right? It very often is not necessarily something that someone walks away and says, you know, that they acknowledge and feel that this is what I did. I treated this person differently, or I looked at them differently because they didn't remind me of my grandmother or my grandfather or whatever it may be. Sometimes it's this unconsciousness of it. And, you know, thoughts about how we raise that to a level of consciousness, or do you think that that's part of what has happened over the last year, is that the level of that's brought to a level of consciousness now? What are your thoughts?
Well, I think COVID and George Floyd, I mean, I bring the two together because, you know, 600,000 dead. And in the midst of what my sister described as this holy hush on the land, where everybody had to be still, we saw a public lynching with the murder of George Floyd. Gave us a sense of a kind of common vulnerability, you know. So, and that moral reckoning, that racial reckoning was already happening as Black Lives Matter had kind of emerged, not as a movement, but as a broad sensibility that evidenced itself in pressures in response to what Trumpism had unleashed, what we were seeing across the nation as the ugly underbelly of America was making itself known. And we're struggling right now for our democracy in some way. But I want to be very, very careful about implicit or unconscious bias often lets folk off the hook. I rather use language like habit. We have been habituated in the US to live the value gap. We've been so habituated we can drive throughout Boston. I could drive throughout Princeton, knowing that those communities have been zoned in such a way to reflect the value gap. Our built environment reflects it. Just moving from Cambridge to Roxbury, just driving, or for me, telling my students, just walk down Witherspoon Street in Princeton, and you're gonna bump into the people who clean up your throw up on Thursdays, Fridays, and Saturdays. Zoned to learn. So we're habituated, and habits are your responsibility. If you're addicted to smoking, we don't say it's unconscious. We try to begin to get you to orient yourself differently to the addiction. You see what I mean? So I don't want to talk about unconscious or implicit bias. I want to talk about how we have been habituated. And again, going back to Aristotle and John Dewey, habits, because this is the ethics of anti-racism, habits are direct reflection of character. That's where character is located. So we are habituated to value certain people more so than others. We are habituated to be okay with communities being locked out of healthcare or locked into prisons or treated unequally by the police. And that disfigures and distorts who we take ourselves to be, such that we can't become the kinds of people that democracies require. We're willing to give democracy away in order to defend the value gap. So I'm a bit hesitant about, hesitant. We're gonna use that word about implicit.
Well, what I love about thinking about in terms of the habits, I love this because you can develop new habits.
Exactly.
You can replace old habits with new habits, right? But you have to be intentional about it.
Exactly.
Right? And that gets to this part about the hope, right? And you write about this as well, and you talk about this. So we got this, but tell me about the hope in this.
The hope is us.
Yeah.
You know, if I didn't have faith in us, you know, I would be drinking too much Irish whiskey, you know, which I love, you know. Baldwin used to say, hope is invented every day. One of my favorite lines. And if hope has to be invented every day, that means you're fighting despair every day. Mm. You're trying to keep it at bay. So it's a blues-soaked hope. I have a faith in us, but I also am not naive. Human beings, as Baldwin used to say, human beings are both disasters and miracles. We have to protect ourselves from the disasters that we've become. But if we show up, Doc, if we show up, there's a chance for a miracle. Mm-hmm. And so the question for the Dimmick Center and for all of the people who are within your orbit is how you're going to show up. In what way are you going to show up? Are you going to show up with this charitable orientation, with this philanthropic orientation that you're trying to do somebody a favor? Or are you fundamentally trying to make healthcare just without exception? Mm-hmm. Without exception.
That's good. That's good. I think that is a great way to end this segment. That was perfect. Thanks again. Beautiful. And I see Raquel's coming out to give us the hook anyway.
Well, we're not done just yet. This is an incredible conversation, and we're going to take it a little bit further because we have some questions. So let me start. Dr. Glaude, a question for you. Considering the current moral psychology of the nation, how can Dimmick help shape a more equitable environment in America? I know you probably did address some of this already, but if there's anything you'd like to go deeper on.
Well, you know, I think, I want to recognize my limitations here. Dimmick knows what Dimmick can do and what Dimmick is doing. As an outsider, the only thing I can say is that, you know, Dimmick has to model a philosophical and practical understanding of healthcare, right? That cuts against the grain of generation, right, of healthcare delivery, that undermines the history of bias that defines healthcare delivery. And the way in which Dimmick can do that, in my view, is the way the nation must do it. First, you must be honest about how it all came to be. Don't lie about it. Tell the truth. And if you concede to the truth that you know, then make the decision to remedy it in your own space, within the context of your own resources and mission. That's what I would say.
Thank you. Thank you very much. Dr. Anderson, do you want to add anything to that?
I think that is, you hit the nail on the head, right? But I do think what I appreciate is the two-step process, right? And it is the acknowledgement, and then, because you can't get to real solution. And I talk to my team all the time about, it's not about the answer, it's about the solution. It's this process, and within that process, it's this acknowledgement of where are we, how we got here. And so
I use, when I'm talking around the country, I use this analogy. I said, if there's a lie at the heart of the marriage, and you're not addressing the lie, but you're trying to fix around it ain't gonna work.
That's right.
So we have to get to the heart of the matter.
Right.
Tap it at the root.
Nice.
Yeah.
Here's another question. Again, Dr. Glaude, to start with you. How can an institution such as Princeton University use its academic research abilities to develop remedies to racism?
Well, first, Princeton has to deal with its own history. Right? It has to diversify its own faculty. It has to begin to, commit itself to being an institution that isn't approaching the matter of higher ed as a charitable issue. I mean, it has this multi-billion-dollar endowment has this power. It can begin to leverage its power in so many different ways. So I want to see Princeton leveraging its power with regards to all of the businesses that it engages with. Right? What are your diversity numbers? I want to see Princeton using, if you're going to do business with us, I want to see your board. I want to see Princeton doing things that I know that it can do. And I think hiring faculty and developing research. And so we have wonderful folks like wonderful folks in the psychology department who are working on the psychology of race. We have, I think, the best African-American studies department in the country. We have scholars doing all sorts of work, but the institution of Princeton as one of the premier sites of higher education, it can begin to leverage its weight in a much more robust way. I think Harvard could do it too. University of Chicago is trying to do it. Yale can do it. Princeton isn't singular, but we need institutions of this sort to begin to assert its value and weight if we're going to fundamentally transform the society alone.
Thank you. Dr. Anderson, as an alumnus, anything you'd like to add to that?
Hey, let's put it like this. First of all, I wish that I was on campus now with Professor Glaude. That's the first thing. I'd be a lot smarter on these topics than I am today. Let's put it that way. But the only thing I would add is that there is an element of the experience that students have on campus that also impacts the way they think about the world once they leave campus. So there's also that internal work that organizations like Princeton can do in thinking about these amazing minds who want to come out and build a different America.
Indeed, indeed.
So the next question, it's a detailed question and it's a significant question. I'm going to shorten it, but maintain its intent. A participant states that they have been at a loss as to how to deal with this reality that there are people living in America who believe that Black people are an inferior race and that institutions should not prioritize the support of them. How can we have the words, and what words can we use to address such feelings when we hear that from people?
The most difficult aspect of that is when it comes from people you love. You see? There's something about what happened on January 6th that's so familiar in this country. There are people who are shouting at the top of their lungs about being replaced, and their uncles and aunts, their neighbors, they're our local law enforcement, maybe a doctor, a nurse. So the most difficult part of it is when it's folk we know and we love. But let me put it this way. We only have a finite amount of civic energy. We can't spend all of our civic energy trying to convince people who hold noxious views that they ought not to hold them. I want to spend my energy building the world where those noxious views have no quarter to breathe, where those noxious views give you no advantage. So if I'm about the work of building a more just America, if we're about the work of building a more just healthcare system, those people who are invested in bias, they're going to be on the margin. So I'm not going to spend my energy trying to convince them. I'm going to spend my energy trying to put in place, as what Jimmy calls, I'm going to try to keep trying to build the New Jerusalem, because I only have a short period of time left on the planet. That's where my energy is going. You know, sometimes you have that working group and you have that one person, that one contrarian person, and that person sucks up all the damn energy in the group because we're constantly tending to that one person. If we only just decided as a group to go about the business, and then that person would have to make the choice, right? Not us making the choice for him or her, but we do the work about. So my answer is, I know it's hard when it's loved ones, but you gotta love people anyway. Sometimes you have to love people from a distance, though, right? I know it's hard when it's your loved one, but at a certain level of generality, I'm not going to spend my energy trying to convince people who believe that I'm less than, that they shouldn't believe that. Mm. I'm not going to do it anymore. They don't have that authority. Mm.
Thank you. No, I think that's that's the answer we needed to hear tonight. Thank you. I have one more question. I'll start with Dr. Anderson. It's something that Dr. Anderson has spoken about. Dr. Anderson, could you start this answer? How do we define the difference between health equity and health equality?
That's an interesting one, right? Because it gets to the heart of the difference between equality and equity, right? And people have seen this image before, but let me try to see if I can describe it. You've got three boys standing at a fence, and on the other side of the fence is the baseball game, right? And all three of these boys are different heights, right? So if you give all three of these boys the same size box to stand on, the taller boy can see over, the middle boy can sort of see a little bit, the shorter boy can't see anything. In many ways, that's equal. You've given them equal size boxes, right? And you think you've done something to allow them all to appreciate the game. But the reality, to get to real equity, you need to give each of those boys the right size box so they all have a similar view of the game. That, to me, is what I think about when I think about this difference. Equity requires going that extra step to ask the question, or to answer the question, or I should say solve the problem, that requires us to really dig in and say, what does this person need because of the position that they're in? Very often, not by any means of their own. What differently do I need to do for this individual to make sure that they have the same view of the game, so they have the same opportunity for the similar life expectancy, so they have the same chance of not dying from prostate cancer, and on and on. It's not enough to say, I'm going to provide the same healthcare. That's the same boxes. We have to think about this through that lens.
I love that.
Yeah, thank you. It's an excellent, important way to describe it in a visual that I think that's very helpful. I think we all wish that this could continue at least another hour. And I'd say I'm just so grateful. We are all so incredibly grateful to you, Professor Glaude, Dr. Anderson, for having this conversation, for really forcing us to think in a way that might be uncomfortable, yet is so critical right now and forever. Thank you. This was an incredible conversation. This was a really important part of our President's Council. I had lots of other announcements, but I'm not even going to make them. I don't want to take away anything from this moment. Suffice to say that we will continue this conversation. Dimmick will continue this vital work. We will never let up, and we will do it in partnership with you. We have wonderful events and activities coming up at the Dimmick Center this summer through our Road to Wellness, which is a true sense of health and wellness for all members of the community. We hope you'll join us this summer and at the 5K live in person in September. And of course, we hope you will be a part of our 34th annual Steppin' Out, an incredible celebration of our very special community in October. You will hear more about these events. We will stay in touch with you, and please do not hesitate to reach out to me personally if you want to learn more about Dimmick or get more connected. I am deeply grateful to our fantastic speakers, to our President's Council co-chairs, to our host, Bob Rivers, and to all of you for being here tonight. Have a wonderful, happy, relaxing, and restorative summer, and we'll see you soon. Thank you.